My name is Mary Elizabeth Kraft. I'm 58 years old and live on Johns Island. 4 years from now, on a March afternoon, I will feel an intense pain in my chest. At the hospital, they will be telling me that I'm having a heart attack. I will be frightened, my husband even more so. A heart stent will be inserted to keep the blocked artery clear. It will be difficult, but I will be all right. I will be lucky. I will be taken care of.
At Roper St. Francis Healthcare, we have a singular focus. When a person is sick, our priority is to help them get better. It's always that simple, never that easy, and exactly what compels such special people to work here. Spend a few minutes inside any of our facilities and you'll see this commitment in action. Right now, we're embarking on an ambitious, multifaceted expansion that will significantly enhance our ability to deliver the best care possible to our patients. In the Low Country, heart disease is the #1 cause of death. This and other alarming statistics make it easy to see why development of the Roper St. Francis Heart and Vascular Center is of vital importance to this community. Located in the new patient tower, this treatment-focused center will be the first in our region to offer all heart and circulatory care under one roof. The new center will include state-of-the-art cardiac surgical suites and amazing new technologies. For instance, physicians will be able to receive electronic EKGs directly from the ambulance, long before a heart patient even arrives at the hospital. Roper St. Francis was the first in the Low Country and the second in South Carolina to receive Chest Pain Center accreditation. As we relocate to the new tower, these enhancements will enable us to continue to set the standard in cardiac treatment.
I'm Jack McNeil from Charleston. I've always loved tennis and still play regularly. But about 10 years from now, all the wear and tear on my knees will catch up with me. The pain and stiffness will become a daily ordeal, and my orthopedist will recommend joint replacement surgery. I've never had an operation, so I'll be a little nervous, but everything will be fine. The nurses will take care of me, and I'll be able to do my physical therapy at the rehab hospital right downtown. I'll be amazed at how fast I'll be back out on the court.
An integral part of our new 7-story patient tower, the JULIAN BUXTON Surgery Wing, will include 42 patient rooms designed to meet the special needs of surgery patients. The creation of this centralized area represents the very finest in post-operative care, staffed by specialized nurses able to accommodate the technology necessary for today's medicine. Located on the 7th floor, the rooms will feature expansive views of Charleston Harbor.
My name is Carol Larkin. We just bought a vacation home here and we really like it. In fact, in a couple of years, we'll decide to stay for good. That's about the time I get sick. In the fall of 2008, I go for a routine mammogram, and the radiologist will see something she doesn't like. A biopsy will show that it's malignant. It will be quite a shock. My oncologist will recommend 2 rounds of chemotherapy and then radiation. I'll worry about everything. My young daughter, my husband. I'll lean on the people around me more than I ever imagined. But the cancer won't return. And I'll learn what it really means to call a place home.
As individuals, none of us will ever be prepared to learn that we have cancer. So as a community, we must be. With this in mind, Roper St. Francis has made it a priority to further the hospital's legacy of excellence in cancer care. That means a cancer treatment center that houses the latest diagnostic and radiation equipment, allowing our oncologists to deliver the best possible patient outcomes. In our state-of-the-art center, oncology patients will have access to an extensive new offering of services that provide clinical, emotional, and spiritual support. The most visual of these is a meditation garden where patients can pray and reflect on their wellness goals in a beautiful and serene environment. When we encounter illness in others, we're naturally predisposed to lead them back to health. We see pain and wish to offer comfort. Our instinct in the face of a need is to help meet it. No matter how complex the state of healthcare becomes, the practice of medicine should always come down to these simple human truths. At Roper St. Francis Healthcare, they have always been our foundation, and they will forever be our guide.